Let's now turn to Anambra State, where a transformative approach to public health and community development is gaining momentum under the leadership of the State First Lady, Dr. Soludo. A passionate health advocate, Dr. Soludo has launched several impactful initiatives aimed at combating child malnutrition and tackling other health challenges. She has also been a driving force behind preventive healthcare campaigns, including the recent rollout of the human papillomavirus vaccine targeting girls aged between 9 and 14, aimed at reducing the prevalence of cervical cancer and improve long-term health outcomes for women in the region. Beyond healthcare, Mrs. Soludo champions youth empowerment through technology and innovation, encouraging young minds to harness digital skills. But how well has that been? And now, Dr. Soludo, First Lady of Anambra State, joins us on the program live from Awka to share more about the project and the journey towards a healthy and empowered Anambra State. Thank you, First Lady, for your time. First, let me condole, of course. It's a sad moment with, at Anambra State, of course, some indigenes, like was released in a statement earlier, were affected. How are you handling this?
The what happened in Okija. Yes, it was really tragic what happened there, a lot of lives were lost when a good citizen of the state was set up to help people, but unfortunately it turned out to be what it was yesterday. And it was a very, very sad moment for us. But we pray that God rest their souls.
Indeed, a very sad moment. Anyway, let's dive into the conversation, at least some of the work you're doing in the state. Your initiatives are reshaping the public health landscape in Anambra State. What inspired you to focus on health and community development as key pillars of your work? Let's start from there.
Yes, thank you so much. Yes, my initiative, Healthy Living with Soludo initiative. Yes, it's something I've been doing for the past 17 years now. It started as a passion because I was once on the other side, wasn't really taking too care of myself, and I saw the impact and what it means, not really taking care of yourself. And 17 years ago, I took a very decisive decision to change my lifestyle, and everything changed for me. So for 17 years, it's been a passion I've been driving for 17 years, turned it into a business. And now in Anambra, Healthy Living with Soludo is a crusade, and we are really doing a lot with it. We've set it up as a club in all the secondary schools, in local governments. We've been working with our youths, training them on a whole lot of things. We have 6 pillars under the initiative. We have hygiene, nutrition, fitness, basic life support, reproductive system, and we've been pushing the 6 pillars, set it up, helping our children in schools, in local governments, our youths, teaching them. We've set up, as I said, in schools, we set up what we call pad banks in schools, something very unique, setting up these pad banks in school, making sure these children, for our girls, because a lot of children there will be in school and have this emergency. And, imagine a child having a girl having that kind of emergency in school. The whole day is gone for him. He's sort of thrown off balance. But now, having this kind of thing in school, we set up basic life support, teaching our children how to help during emergency. Because what we have now is during emergency, everybody is videoing and sending to creating content with people's life. But now I'm teaching them when something like that happens, this is how you help the person. Before you call, now in Anambra we have ambulance services. This is what you do. Then before calling the ambulance to come and help, teaching, that's what we call basic life support. We've done a lot in Anambra with this initiative. We've done the cervical cancer screening. We've done for over 11,000 women, and we are still counting. We've distributed 3.8 million mosquito nets to reduce malaria in Anambra. Then, a few months ago, we launched what we call Nonye's Healthy Living Path to reduce malnutrition in children in Anambra to almost 0%. Yeah.
All right. Let's talk about child malnutrition. Pardon me to button. Let's talk about child malnutrition and interventions. We know that malnutrition remains a significant challenge in many parts of Nigeria. Can you walk us through the concept behind Nonye's Healthy Living Path for malnourished children and how it's addressing this issue in the state? Yes,
thank you so much. Because we noticed that a lot of children are malnourished. Yes, some time ago, we noticed that a lot of children are on the red line when it comes to malnutrition, that a lot of children are malnourished. So I came up with this Healthy Living Path. We launched it a few months ago. That was about 4 months ago. Distributed it to all the local government TC chairmen, and we noticed the thing was doing well. A lot of testimonies from mothers, from the hospitals where these children are. So now we've stepped it down to all the communities, 170-something communities in the state, and even 326 wards in Anambra State. We've distributed it to them, and it is doing really well, and it is free of charge.
Okay. Yes. You recently, First Lady, I just want us to touch on a few things before we let you go. You recently rolled out the human papillomavirus vaccine targeting girls aged 9 to 14, aimed at reducing the prevalence of cervical cancer and improve long-term health outcomes for women in the region as well. But what has been the response from the community so far, especially parents, and how do you address hesitations about vaccinations? And quite a lot of community members may be hesitant when it comes to vaccination.
Yeah, exactly. Thank you so much for this, because it's a big problem. And I think a lot of first ladies are having, but we are really pushing. Because initially when we started it, a lot of children, some parents were really happy. But we along the line, we noticed that some people started telling them other things which doesn't make sense. Because we are lucky to have this cancer that we can take vaccine to control. And I am still telling parents, every time I have an opportunity to stay with parents, I tell them this is something you must give to your kids, to your girls at that early stage to prevent this. It's not a vaccine that just came out yesterday. It's been there. There is no side effect. They need this. Cancer is everywhere now. So we are lucky to have this one that can prevent this particular cancer. So I am telling women, it is working. More people are coming out. Because this is something we are doing free of charge here. If they are to go to hospital and do it on their own, they will spend over 20,000 or 20,000 or thereabout to do that. So we are telling them, come out. I am appealing to mothers. It is not a new vaccine. It's been there. It's been tested and trusted. Give these children, these young girls, this vaccine. It will really help them. Thank you. So we are pushing, and it is gaining ground. Every day, more people are coming out for it.
All right, First Lady. Beyond healthcare, you've also been an advocate for youth empowerment through digital skills. Would you want to tell us how that is playing out, alongside your health initiatives, and particularly also speak to how do you ensure that these programs reach every community, especially those in remote or underserved areas?
Yes, thank you so much. And Anambra State is really doing a lot when it comes to IT. A lot of our children are being trained last year we did quite a lot, and they were, after the training, they were provided with funds to start something. A lot of them are going through the same program now. A lot is happening in Anambra when it comes to ICT. We are really working with our children, and we are happy they are really embracing it. And we are calling all of them. It is open for everybody. It is free of charge. You just come, register wherever you are, and be part of this wonderful program. We are here, the government, the Solution government is here to help all our youths to reach their potentials.
Finally, before I let you go,
so
First
much.
Lady, what keeps you, motivated to champion these causes? People may want to know. And how do you balance your role as the First Lady with these extensive campaigns?
Yeah, for me, it's something. When it comes to health, it's something for me. I love, when it comes to health, I'm always there, for the people. It's something I love doing, touching lives through health. Like there's something, again, we did in Anambra, sharing seedlings to people, to create their own gardens, to eat right. Because for me, health is the greatest wealth. So that's why it gives me joy to let people know that our health, to prioritize our health. Because when you don't have a good health, there is nothing you can actually do. So we shared free seedlings to more than 8,000 people. Now we are going to local governments, setting up gardens everywhere, because we want to launch what we call farmers markets in every local government, in every school, in hospitals, so that people can buy their food very cheap. Because when they get it there, we will supply all the seedlings to them. And so that we set up what is called farmers market. Some have started and are doing so well. They get what they get in the market. They get about 30% of what they get in the market. And it's working very well for them. Because we cut out that middleman. It's just from farm to consumers. So we are setting it up in Anambra State that every local government, even communities, we have these farms, and we are championing it, and it is going very well.
Thank you for sharing your journey with us, First Lady. Truly inspiring. And we do hope that more residents of Anambra will enjoy or benefit from this initiative. Thank you for being with us on News Night.